Healthcare justice. What every college student needs to know. What if a visit to the doctor meant confronting not just illness, but injustice? For millions of Americans, especially Black, Indigenous, and people of color, healthcare is not just a matter of medical care, but an ongoing confrontation with systemic racism. This documentary seeks to expose the harsh truth that for many, seeking care means facing discrimination, neglect, and institutionalized inequities that often lead to suffering, poor health outcomes, and even death. It's about the deadly intersection of health and history. This is not a new story, it's one that has been written over centuries, shaped by policies, practices, and prejudices that continue to have an impact on healthcare today. Healthcare injustice refers to the unequal access, treatment, and outcomes that result from structural racism in the U.S. medical system. It is not just a matter of individual doctors or nurses harboring racist views, although that happens too. It's about a system built on a legacy of exclusion and exploitation. From the denial of care based on race, ethnicity, or economic status to the lack of culturally competent treatment, healthcare injustice is a multifaceted issue. The effects are far reaching. Black women are more likely to die in childbirth, indigenous communities experience lower expectancy, and immigrants are less likely to receive necessary care due to fear of deportation or of lack of insurance. These are not just numbers on a chart. These represent real lives lost, communities torn apart, and families left in grieving. Module 6 explored the MAFA, the catastrophic trauma of slavery. That trauma didn't end with emancipation. The history of slavery in the United States did not end with the signing of the Emancipation Proclamation. The trauma it created is still very much alive, passed down through generations of Black Americans. Medical racism has its roots in this history, from the dehumanization of enslaved people used as subjects for brutal medical experiments to the forced sterilizations and exploitation of Black bodies in the 20th century. The legacy of the Tuskegee syphilis study, where Black men were knowingly denied treatment from syphilis, continues to shape the way many Black Americans view healthcare systems. This deep distrust, born from generations of medical abuse, lives on today, influencing how individuals approach care and whether they feel safe in the hands of medical professionals. Colonization disrupted many Native communities. One form of harm came through healthcare, like forced sterilizations of Native women and the denial of adequate medical care. For Native communities, colonization was not just a political and cultural disruption, it was also a violent assault on their health and well being. Forced sterilizations of Native women, often performed without consent or knowledge, is just one example of the horrific ways healthcare was weaponized to erase indigenous populations. Today, many Native communities continue to suffer from inadequate medical care, inadequate access to resources, and a health system that often doesn't respect their cultural practices or needs. This history of harm has created a profound and lasting mistrust of the medical system, one that is hard to overcome when there is little effort to right these wrongs. Module 11 explored how U.S. imperialism shaped immigrant experiences. Many immigrants, especially Latinx and Asian communities, faced language barriers, fear of deportation, and lack of insurance. These structural issues are healthcare injustices too. U.S. imperialism has created a complex and often hostile environment for immigrant communities who face not only physical barriers to healthcare but also emotional and psychological barriers. Language barriers make it difficult for immigrants, especially Latinx Asian populations, to communicate with healthcare providers, receive accurate diagnoses, or understand treatment plans. For undocumented immigrants, the fear of deportation or detention prevents them from seeking the care they desperately need. In addition, the lack of insurance options and the high cost of healthcare creates an environment where many are forced to choose between their health and financial ruin. These are healthcare injustices too, structural inequities that result in harm, suffering, and death. According to studies published in the American Journal of Public Health, Black mothers are 3 times more likely to die from pregnancy related causes than white mothers. The racial disparity in maternal mortality is one of the most glaring examples of healthcare injustice in America. Black women, regardless of socioeconomic status, education, or access to healthcare, are at a significantly higher risk of dying from pregnancy related complications than their white counterparts. This disparity is fueled by a combination of factors: racial bias in medical treatment, underestimation of pain, and discriminatory practices that overlook the needs of Black mothers. Despite the advancements in healthcare, this tragedy continues to affect Black families and highlights the urgent need for reform in how we approach maternal care. Researching this project changed me. I now realize that healthcare isn't neutral, it reflects power, history, and resistance. As I dug deeper into this project, I was struck by how much more there is to healthcare than just medicine. It's not neutral or impartial. Healthcare systems reflect the power structures of society: who is valued, who is ignored, and who is intentionally excluded. As a student and future advocate, I understand now that my role isn't just about learning science and clinical practices. It's about understanding the ways in which these practices are shaped by history and resistance. It's about recognizing how healthcare can either perpetuate injustice or be a tool for social change. Do you want to make a difference? Support organizations like the Black Mamas Matter Alliance, National Indian Health Board, and Physicians for Human Rights. If you're looking to take action, there are many organizations working tirelessly addressing these inequities. The Black Mamas Matter Alliance advocates for the health and well-being of Black mothers, fighting for policy reforms that will reduce maternal mortality rates and ensure safe pregnancies. The National Indian Health Board works to improve healthcare for Native communities, ensuring access to quality services and protecting their cultural traditions. Physicians for Human Rights is on the front lines calling for healthcare reforms that are rooted in human rights and justice. Supporting these groups and others like them is a concrete way to fight back against healthcare injustice and make a real difference in the lives of marginalized communities. Thank you very much.